All right, guys, today we're going to talk about this book. It's from 1999, 2000, Advanced Therapy of Prostate Disease. It's a textbook. And the problem with this textbook and a lot of these publications regarding surgery, even today, the fact of the matter is they're not discussing part of the safety protocols of surgical smoke. A TURP and a TURP are listed in this book. Also, taking out the prostate when there's massive cancer, that's in this book. They don't talk about it. This is a diagram, okay? For prostate patients, urology patients. Now, the problem with this is it's old, okay? And they used to have these resectoscopes that the doctor would actually look in with by, just a lens. Now there's a computer, there's a camera. Once it got into the digital age, things should have gotten better. And let me just flip this around here. And I know I'm in the Middle Ages too here. So here's the doctor looking at it inside, and he's looking at he's going into the bladder with this resectoscope, and then there's a wire at the end of the resectoscope that's shaving off this prostate so that the person can urinate, because this prostate gland has grown to such a degree that surgery was necessary. The problem is it involves some cauterization, and the cauterization would create a smoke plume in the bladder, and then eventually the smoke would puff out of the urethra into the doctor's face. That's a problem because smoke of any kind is dangerous, and as you can see, neither the doctor nor the patient are wearing a mask in this procedure, and you can see that this doctor's not wearing a mask. Now, I think the reason they didn't wear masks back then was because usually the mask was worn to protect the patient from infection from a doctor coughing. This doctor is not near the patient's face, and I guess they didn't feel like germs could go through the urethra into the area, and these people were not protecting themselves. Of course, the doctors did wear gloves, but that was also mainly to protect the patient. So this is a very, very old picture, and it's basically saying a major operative procedure in which the prostate is removed in small pieces through the urethra employing an electrical current. So it's a transurethral prostatic resection. Okay. Otherwise known as a TURP. So transurethral resection of the prostate. TURP's easier to say. So I talked about that paper regarding TURPs the other day too, and I just wanted to review a few things about it. It's the paper is from 2013 in the Journal of Urology, and it was a comparative safety analysis of surgical smoke from transurethral resection of the bladder tumors and transurethral resection of the prostate. And an electrosurgery creates particles whose size is less than 0.1 micrometers. Okay, that's bad when it creates nanoparticles. Let's see here. You have these squirrels making all these noises, and when I go back and watch these videos, I can hear the squirrels. Do you hear them out there?
No.
Yeah. So I don't know what to do about that. I guess feed them some crackers or something, right? Yeah. So in this paper, there were toxic gases that were created, and patients with benign prostate hyperplasia underwent TURP, and these patients also had lower urinary tract infections of mild severity or greater versus the TURP, which was the bladder cancer. In these patients, the prostate volume was greater than 40 milliliters, and the maximal flow rate was less than 15 milliliters per second. Patients with non-invasive bladder tumor diagnosed on cystoscopy and biopsy underwent TURP. Samples were divided into two groups, the group 1 and the group 2. The study was approved by the Institutional Review Board of our medical institution. Let's see here. In the TURP group, the mean age was 69, and human carcinogens so group 1 in this study, gases produced during transurethral resection of the prostate. Those were propylene, allene, isobutylene, 1,3-butadiene, vinyl acetylene, captomethane, ethyl acetylene, diacethylene, 1-pentene, ethanol, piperylene, propynyl acetylene, 1,4-pentadiene, cyclopentadiene, acrylonitrile, and butyrolactone. So human carcinogens include 1,3-butadiene, vinyl acetylene, pentafluoroethane, acetaldehyde, benzene, toluene, ethyl benzene, and O-xylene in the group 2. So moreover, animal carcinogens include 1,3-butadiene and ethanol in the group 1, and pentafluoroethane, acetaldehyde, ethanol, hexane, and benzene in group 2. So 1,3-butadiene was definitely in the TURP. Not to mention the smoke itself. And yeah, you'll have to study it yourself, you know. Sorry, but I hope this was entertaining. And it was, once again, it was the paper that I just reviewed. Obviously, didn't talk too much, but that's part of the study group here, you know, as far as how I'm making this video, to inspire you to learn about surgical smoke, see if it's true. Actually, it is. There's so many studies. And I have some websites that are coming out on surgical smoke. And once again, this was a personal review of comparative safety analysis of surgical smoke from transurethral resection of the bladder tumors and transurethral resection of the prostate. One of the authors, Chin Zhao, from Journal of Urology 2013. Thank you.